welcome to College of Public Health. This is another Black Alumni Connection series, and we are featuring Lolita Poplar today. So everyone, welcome. So on behalf of the CPH Alumni Board, we want to thank you all for joining us today. We are going to be really engaging as far as talking about Child Abuse Prevention Month, and we're really going to be tying that into what all Lolita has been doing since her attendance at UGA back in 1996 with environmental health. So let me start off with explaining, so what is BACS, or the Black Alumni Connection Series? So as a board, myself included, we released this as one of our first initiatives last year during National Public Health Week. And the purpose of this series is to basically commemorate the 60th year of desegregation at UGA. Yes, only 60 years. It has not been that long at all. And so these alumni are able to help us recognize what public health means, and they are definitely the change makers of color, because the college was not even created until 2005. So to me, that just blows my mind. I just graduated CPH in 2016. So this whole series has been very near and dear to my heart, and it's been very nice to see other Black alumni doing just as great things as I have learned and watched along the way. All right, so with that being said, I also want to acknowledge this is our 1-year anniversary. Like I said, we started this last year for National Public Health Week, and it has already been 1 year. Our president, Erica, who you'll hear from here shortly, as well as closing us out, she has all these amazing ideas, and this happens to be one of them. And it has really, really set the tone as what we started as a board and how we're going to finish and how we're going to continue our journey, right? So again, congratulations to the board. Thank you for all of the alumni who have come through this series, shared all of their endeavors and all of their greatness. We have much appreciation for you guys, as well as all of our donors who contribute and make this happen for the College of Public Health. All right, so with that being said, I will now give the board an opportunity to introduce themselves, followed up with the introduction of Miss Lolita herself. And then we're gonna start rolling with this great conversation, getting to know her a little bit more. And then we'll close out with our president, Erica Parks, to talk a little bit more about the purpose of the board and what we're going to be doing looking forward. So I'll start with myself. My name is Quintunya Chapman-Hamilton. I am a graduate of College of Public Health, Health Promotion of 2016. I am currently a well-being coordinator for Cigna, and I am always happy to be here to learn more about you guys alongside my board members. Moving on to Samrina, are you there?
Hi, everyone, and yes, I am. Apologies, I'm on my phone today, so I can't turn my camera on, but good to meet you all. My name is Samrina, and I'm a College of Public Health graduate, class of 2018. It's an honor to be here, and I'm excited to hear more from you, Lolita. I will pass it on to Adam Bowling.
Thanks, Samrina. Hi, all. I'm Adam Bowling. Came through the Bachelor's of Environmental Health Science program at UGA. I'm glad to hear today from our speaker. Welcome, and thank you, Quintunya, for hosting us.
Thank you.
Awesome, Adam, thank you. Let's go on to Adam G. You know, we do you guys back to back all the time. Adam G, are you available? All righty, let's go on to Lori. Lori, are you available? There we are.
I was on mute. Hi, everybody. My name is Lori Elmore. I am College of Public Health. Well, really, it was the College of Education when I was at Georgia. So I graduated in 2000. So am excited to hear about your experience. Thank you for being here. Welcome, everyone.
Awesome. Moving on to Regan.
Hi, good evening, everyone. I'm Regan T. I'm a 2009 graduate of the College of Public Health. I'm also a member of the larger UGA Alumni Board on the Student Engagement Committee, and it is my absolute pleasure to be here for this interview. Thank you.
Awesome. Thank you, Regan. And then we have Kim.
Hi, I'm Kim Metcalf. I am a UGA graduate with environmental health science as well, so I'm excited to hear Lolita and what you have to say and what you've been doing with your degree since you left. I have a bachelor's and master's from 94 and 96.
Awesome. And oh, we just had one more board member join, Valerie. Valerie, if you're able to speak, we are doing brief introductions of the board members.
Hi, thanks so much. I'm sorry, I'm not sure what the introduction format is, but tell me the questions and I'll answer them.
No questions, just your name, a brief introduction about what college you went to perhaps, and just you're here.
I'm here, that's right. Well, thanks so much. Yeah, my name is Valerie Kimbro. I am a proud alumni of the College of Public Health, both the Masters of Public Health program and the Masters of Health Administration. And happy to serve on this board, and I work in public health consulting. So thanks so much. I appreciate you doing this tonight.
Awesome. If that is all of our board members or not, speak now or forever hold your peace.
I'm going to speak now.
All righty.
Erica. Hi, everyone. I'm so excited to see all of you here. I see we have 16 people. Yes, I'm that person that keep numbers. I am the board president, and I'm excited that you came. I hope you come back. Tomorrow, you will receive a link from us to fill out a short survey just to let us know how you like this Black Alumni Connection series. Was your expectations met, and how can we improve it? We're excited about our first year. We first started off as a working group, which is also going on our 2-year anniversary of turning to a board this fall. We will be having some new board members coming onto the board, but I'm an alum from the College of Public Health and Health Policy and Management, and I am a veteran. So I'm excited to hear your talk. I'm an Army vet who I know you're a Navy vet. I had to mess with you.
Oh yeah. I'm sorry that you had to go Army.
You know. Sorry, I did Army. Yeah. I know the grunt work, right? But I'm excited to hear you tonight, and I look forward to talking to you all at the end.
Awesome. So yes, everyone, that was our president, Miss Erica Parks. She will be closing us out. So feel free, if you do have any questions during the interview, please hold them until the end, as we'll also be asking throughout. Just place them in the chat, and we have someone monitoring that so that we can make sure that we're answering all your guys' questions. Okay, so let's go ahead and introduce our speaker. I know she's been waiting, she's been watching, she's been, just patiently awaiting, because I definitely told her, I said, hey, this is your time to shine. A lot of us don't like to showboat or talk about ourselves, or whatever you want to call it, as far as when you have endeavors and when you've been doing something so great. A lot of people just kind of do it very secretly and in hiding, but now is the time that we want to acknowledge all of our Black alumni when they're doing something as great as Lolita. So her introduction, if you have not read it, it's okay. I'm about to read it to you. Veteran U.S. Navy officer and community leader. Lolita is a unique change agent with over 20 years of client-facing roles in public health, operational readiness, and customer service. During her military career, she held various leadership roles in manpower, management, preventive medicine, and occupational health operations. She is driven by her love for people and her passion for teaching. Lolita founded Nourish to Life, an outreach ministry that empowers at-risk populations to achieve optimal generational wellness through guidance in public health, disease prevention, and self-help recovery. Notably, Lolita's image is included at an historic public mural as the first African-American and first female to command the oldest American Legion post in Tennessee. Now, if that doesn't give you goosebumps, then you must not have listened to what I just said. Okay, the first African-American woman. Anytime you hear that, it is just mind-blowing, groundbreaking experiences, because we know what it took to get there. Okay, so without further ado, Lolita,
hello,
how are you doing today?
I'm just honored. I'm humbled. I'm honored, and as you and I. Please forgive me if I'm calling you all by your first name. So I'm Lolita, but as Erica said, even though we had that fun teasing of each other, it's always an honor to see another veteran, particularly an African-American female veteran, because a lot of times we're overlooked. And So I'll talk more as we get into the talk when we get down to the part about veterans. So thank you for your service, ma'am.
Absolutely. Look at that. Navy and Army, we can get along, right? Everyone can get along.
Yeah, we might after the call.
That's public health. Public health. We got to know how to get along with people, right?
Yeah.
You got to see those differences and make it work. So I love that. All right. So Lolita, if you do want to give us just maybe 30 seconds about where you're at now, and then we'll start rolling into those questions so that we can get more into more details. Okay. So just 30 seconds, a quick, brief scenario about what you're doing now.
Well, right now I am the environmental science teacher at the New Orleans Military and Maritime Academy. And that's in the Algiers area. I don't know if y'all are familiar with the New Orleans area, but it's not far from downtown. It gives me an opportunity to pour into the lives of young people because as you often hear the saying, the children are our future, but I add that they are our future today. And we have to invest into them today so that our world can be better. And you'll often hear me tell the students that all of us are responsible for making this world a better place. And it begins with each and every one of us. And we have to drive that by love.
That is phenomenal. Can you go teach at my kids' school, please? I want to make sure that they're getting that. Okay. I really want to. Okay.
It's so critical.
From that, it is. I completely agree. I do. So with that, you being a teacher now, let's start off with number one. How did you become interested in environmental health?
Well, it's a couple of ways, and I've been thinking about that. When I was little, I don't know if you all remember the CEDAR program back in 1977. My mother was a health worker in the schools, and she would often come home and talk about how she would talk about preventing cavities, or she would go to different schools and talk about immunizations and vaccines. And at the time, I was just intrigued by that. And it was always said when I was little that I'd be a doctor. So I had chemistry sets and et cetera growing up. And from there, I was able to continue in my science career. Through high school, I went to Renaissance High School and specialized in science and biology, thinking that I was moving into the medical field, but the word environmental grabbed me. And when I saw that, I went to actually started off at Savannah State College, which is now Savannah State University. And I was doing research under Dr. Thomas Kozel and at Cumberland Island. And we were in the lab and I said, sir, when do we interact with people? Because I love people. I love talking and just getting to know people and helping to elevate them to their best selves. And he said, well, most of the time you're going to be a lab rat and you're going to be in the lab. So it's not a lot of people. And he said, have you ever thought about environmental health? And from there, that's when I went on my quest to search what environmental health was all about. And when I saw it mirror some of the things that I watched my mother do, and also, unfortunately, you often hear people say we had hard times. Well, sometimes hard times fell on us, and we went to the health department for our treatment and care. And so I also got introduced to that. So all of this was coming back to my mind as an adult in college. And I said, wow, I've been connected to environmental health all along, public health all along. So that's the connection there. And that's what got me on that path.
Wow. Isn't that impressive how public health works?
Oh,
you don't really know you're surrounded by public health until we're in our majors at not just at UGA, but basically any college of public health really. And then you're listening and you're just like, oh, wait, this has always been in my life, right? But it took for you to understand, like, I don't want to be in the lab. I need the people. And that's exactly what public health brings. I do. I get that. And I love that. It's one of the reasons why I went into public health as well. So I love it. With that, can you walk us through that process or your progression of your career from UGA, from a UGA student? We all know that experience, right? It's an amazing experience.
Yes.
So from UGA to the Navy, working in that medical service corps and manpower officer, into your nonprofit organization, Nourish to Life?
Yes. Well, as I said, when I transferred from Savannah State University, which Savannah State SSC is what I always call it, and from the environmental science program. And when I transferred to the University of Georgia, during that time, it was evolving. And when I got there, it was more moving toward the direction of environmental science because it was under, and Kim, you'll be able to remember this, it was under the College of Agriculture. And so the focus was actually, from my perspective, turning more toward the environmental science component, which I just left from Savannah State. So I did take environmental health class. And once I took that, I found an internship, moved into the health department there in Athens, Georgia, was trained by the best. And I remember my first supervisor say, I'm going to teach you how to get nosy. So we would be doing inspections, housing inspections, food inspections, you name it, from an environmental health standpoint, and visiting and talking with people, which that was my baby, doing that. And then from there, I continued on in Savannah, Georgia, worked for the health department there. When I returned to Michigan to help take care of my mom and some other family matters, I saw a commercial and it said, the Navy, accelerate your life. And when I say accelerate your life, it sure did. And from there, different from the health department, once I became a naval officer, I immediately was placed into leadership. And from there, my boss, I remember my first boss in the Navy, I actually came in February of '98. And that, if y'all recall, that fall, Hurricane Georges consumed the entire island of Puerto Rico, which that was my first duty station. And I remember my boss turned to me and he said, baby girl, you got this. So I had thousands and thousands of base residents, as well as millions throughout the Caribbean under my watch, being in control of the entire preventive medicine and public health operations during Hurricane Georges. And you talking about being humbly afraid, but yet emboldened to do whatever I needed to do to protect the lives and the well-being of all of those people. I'll never forget it. And I'm so grateful for that opportunity. From there, I progressed to different duty stations. I won't tell you each one because we'll be here forever, but it gave me an opportunity to connect. And a lot of my staff members say, ma'am, you never stay in the office. You're always out. And then you bring people in and you introducing them to us and what we do. I said, because teaching is learning twice. And as we continue to teach and we connect and each one teach one, each one reach one, that's how we make this world a better place. And so I would find people and bring them in and they said, you know, you're not supposed to bring these people on base. I said, but they're curious. They want to know what we do. I said, I could take them if we altercation. We got enough security around here. But it was just an awesome, wonderful time. And I remember just giving you a little tidbit when the bomb of the USS Cole occurred in Yemen. My staff and I were watching it on TV, and we knew right then and there that the EOD, or Explosive Ordnance Division, I don't know if they still exist now, we were responsible for making sure that unit was sent to Yemen to respond to that. And at that time, you all may know as well, being public health practitioners, there was a shortage of influenza vaccine, and no one knew how to get the vaccine. And then my boss said, I bet you know. I said, yes, I met with the health department and I've connected with the people there. They've had a stash for me if there's an emergency. So I say that to say, and I know we're going to probably get to some more things about for the graduates, but I say that to say to cherish the connections you make. And when you meet people and they see that there's a genuine love and care for who they are as individuals, as well as a respect for what they do, doors will open. You don't have to be put on airs or anything. Just be who you are and let people know that there's a need and that you'll be available to them when they're in need. And just like that, we were able to get that vaccine, get that ordnance division to Yemen so that they could respond. Then from there, as I progressed through the Navy, I actually transitioned from Medical Service Corps to line officer to focus on manpower and management. And that's where another moment in history where I'm humbled and honored. I was the first African-American and first female to command the Naval Support Operation Facility in the Upper Peninsula of Michigan. And that again was unprecedented, and it was an interesting and humbling and challenging experience. So I did a lot of educating. A lot of people who look like me were not up there, and had some run-ins with the police. I won't tell you all the horror stories. A lot of racial tension, but best believe that when they saw me in my uniform, there was no doubt that I brought my A game. And when I say that, I mean the best of who I am, standing on the shoulders of many. And whatever biases or racial issues they had to deal with and reconcile with in their hearts, because I know how I was raised to love all, it caused them to pause and they say, okay, that's the captain over there. That's the commander over there. Let's show respect. And not only was it respect for me, but I felt like it was respect across the spectrum. And then from there, I had my own health issues. The challenges of global war on terror caused me to have to address that once I came out. And that's where the birthing of Nourish to Life came to be. As I researched my own challenges and relationship with food, and also being self-help recovery from childhood issues, I wanted to share that with others. And again, each one teach one, each one reach one, so that people know that they're not alone. They're not alone. And when they see that love connection, reaching out and showing support, then that healing becomes clearer and more accessible. And so now I have that opportunity to pour into the young people here at the school. But Nourish to Life, I still practice that as well. And I have to say this caveat because I run into some people who say, well, are you a psychologist, a psychiatrist? Well, I'm trained in ministry, of course, because that's who I am, minister of the gospel of Jesus Christ. I'm also trained in secular counseling, but I also know that there are legal limitations that I have. And the challenging part is when I come across a psychologist or psychiatrist who says, I have one of your people that you're working with, and they get a better breakthrough with you than they do with me, and it's causing a problem. But the tongue-in-cheek comment that they've made, they understand that whatever it takes to help someone heal is the most important thing. And I'm, again, humbled and honored that I've been gifted with that ability to meet people where they are. And because I've never forgotten from whence I've come.
All of that, Lolita. All of that is amazing. I mean, the epitome of treat people how they want to be treated, how they desire to be treated, how you want to be treated, all of that. And that has carried you over into so many other sectors of your life, breeding that success that you are here telling us about today. So I absolutely love that. Again, if anyone has any questions about anything Lolita is mentioning or talking about, or any comments, please feel free to put those into the chat. So moving on a little bit into Nourish to Life. What challenges? So now we're more onto the business side of things. What challenges did you experience in the early days of that, and how did you overcome them? Because we now know you fought a lot along the way. So as an entrepreneur, what types of challenges and how did you overcome them?
Well, one of the things that I faced was whenever I would do a workshop or presentation in the community, pirating was a big issue. And when I say pirating, people would record what I say, or they'll take pictures and proprietary information and without asking. And instead of taking an opportunity to invite me to come speak at their organizations, they'll take, I found one man, he took all of my presentation information, changed the name, put his stuff on there and said that it was his. And we happened to be at a conference. And I said, wait a minute, that's my stuff. And so what I learned from that is to make sure that all of my stuff is copyrighted and that it is protected. Another issue that I ran into was, unfortunately, racial discrimination. I would be doing advertising that I would be speaking at a different place or a particular organization. And there was one community center that I would speak at every month, and it was still segregated. Or let me correct that. People chose to separate themselves. And so whenever they would see that I would be coming to set up and to do a topic or whatever the topic of the day would be, unfortunately, the white people would leave and the Black people would stay. And so I started going to the restroom before I would present and followed where the white people would go. And I would just hang out around those areas. And I say, hey, I wouldn't introduce myself because there was no pictures with the advertisement. I say, hey, did you hear that there's going to be a talk today on whatever the topic would be? And they say, no, we didn't hear. I said, yes, she's about to start. And, would you like to come? I said, I know it's going to be interesting. And someone would just happen to come into the bathroom that particular day and say, oh, welcome, Ms. Poplar, you coming to speak, And so the person would say, oh, no, not today. And so that would go on, unfortunately, for a while. And so what I did to overcome that, I said, okay, Lord, even though people have chosen not to come because they see who I am and they've judged me by the color of my skin, what I'm going to do is make my presentation so exciting, so interesting, that word of mouth would make them feel ashamed for not showing up. And so as the word got out, they would stick around and say, well, let me see what she's talking about. And that's how I overcame that part. But it was still, still a battle because everybody didn't come. It will always be someone who was courageous enough to stay, and then they would try to convince others to come. But yeah, and even with organizations, I would hear, oh, we would love for you to talk to our African-American women about whatever issue. And I said, well, wait a minute. The topic that I'm talking about affects all of us. Oh, well, we understand that, but we want you just to talk to our Black women or our Black people or our Black children. And so breaking down those barriers, again, building that trust, and just continue to do what I do and be me and bring forth whatever the wisdom and knowledge that I've gained so that it could be received by all. And I remember, and I'll just say this one story real quick about when I was in the Upper Peninsula of Michigan. Here I am, again, humbled and honored to be the first African-American and first female to command a Navy installation in the Upper Peninsula of Michigan. And I had middle school and elementary school not far from the facility. And so Black History Month came, and the principal made it a point to stress the fact that I was not wanted there. No one needed to see me. And it's not like these children will ever live in Chicago or anywhere like that. They're fine knowing who they are right here in the Upper Peninsula of Michigan. And I said my piece, and I won't say all of that, what I said, but I did let her know in a firm yet loving way that these are our children, all of them. And they need to see someone who looks like me. because the children never saw a Black person. And by lovingly pushing my way into her schools, she said, I will follow you every classroom you go to, and I'm going to watch you because I know how you people do. Well, long story short, when I walked in the classroom, of course, the children were, in awe, and they were shocked and they were quiet. And I said, you are somebody. And I went in and the whole, like Reverend Jesse Jackson, so to speak. And I said, how many people have ever seen anyone who looks like me? And the hands said, no, the children, nobody said. They said, can we touch you? Can we touch your hands? And so as the principal, and she was on my heels as she went to every classroom, it got to the point where she was able to see, by the time I was able to build a connection of love with those children, and they were running up, touching my hand and wanted to, see if they still thought that it rubbed off. And some of them would call me the N-word. And I said, baby, don't say that. And they said, well, isn't that what you are? I said, no. I said, I'm a wonderful Black woman, and you have an opportunity to meet her. And you can ask me whatever questions you want, but don't ever use that word. And so they said, okay. And so they'll ask all kinds of questions. And so when she was able to see that, the principal, she said, you know what? I was wrong. I'm going to let you talk to all of my classes. And so that gave an opportunity for those children to see and learn and grow spiritually, racially, and just as a human being, that connection there. And I again, am humbled and honored that I was there. As I said earlier, like my supervisor said, I did my thing, not in my power, but just by the love that was instilled in me so that they can be the best that they can be.
I am 99.9% positive that there are still students or now adults out there talking about that moment.
I hope so. I really hope.
That is such a significant moment in a child's life when you acknowledge that I've never seen this before. Mm-hmm. Mm-hmm. And for you to do it so lovingly and so graciously, you literally led by example. You have led by example, and you show that to the children and you show that to the principal. Yeah. And how many of us have heard of FOMO? Have you guys ever heard of FOMO? If not, it means fear of missing out. And I wasn't even there at those moments, but I have a fear of missing out on all of those talks that you provided those children.
Yeah.
Because I know as a kid, when you hear that speaker and you feel their presence and you learn at a certain time in life, before we got to college and had all these papers and stress on campus and things like that, we were so intrigued with just unintentional learning.
Yeah.
So I know for a fact that you did just that. And it's amazing to hear that. So I thank you for all the lives that you touched as children, not just for Black women, but for the white children as well. So I absolutely am amazed by that. Okay. So moving forward, you also have a background in food psychology and the crisis intervention and self-help recovery of children. How can other public health practitioners and professionals, students, researchers, all of them meet the health needs of adolescents, like the ones that you spoke to and you noticed that need? How can we help meet the health needs of adolescents and enhance their health outcomes?
That's a great question. It starts with the adolescent by asking the adolescent, what do you think you need in order to begin this healing journey? You'd be surprised, even though children may not understand what's going on or how to express the challenges they feel or experience, just by acknowledging that we recognize that there is something that they're dealing with, an issue. They appreciate that. Even here at the school, when I'm dealing with the teenagers, they said, Ms. Poplar, no one's ever asked us questions or just thought that we had the answer. They just dictate what we should do and how we should feel, and we better do this and get it together, blah, blah, blah. And I said, well, I want to know what's coming from you. What is your heart feeling? And as an adult, we know that the children don't know how to fully explain everything. And that's where our guidance comes in. So when it comes to your question about what we can do as public health practitioners, find out where they are, what level that, let me rephrase that. Find out if they're even able to articulate what their pain is. And if not, then you'll often hear me say, meet people where they are. Start from there, and then help to guide them in the direction toward healing, toward life, hence nourish to life. And that's one thing that can be done, meeting people where they are. Second thing, learn as much as you can. And again, Kim can talk about this from the environmental health standpoint, and anybody else who's gone through the environmental health, and as well, I guess all of us, public health. We are often placed in circles where people don't know what to do with us because we know so much about a whole lot of stuff. And so they're like, well, you all are generalists. Are you a nurse? Are you a doctor? Do you know what you want? We're able to advise doctors. We're able to advise nurses. We're able to advise from the highest ranking officials to the everyday person walking down the street to help them live. And prevention, we know, doesn't have the money. It's not the sexy side of things, as they say, as the treatment side, which has the money. But if we as public health practitioners on the side of prevention continue to stay united and continue to go in those places where we're faced with ambiguity, or we are considered the ambiguous ones in the room, when we know that we actually sit on top of abundance of knowledge, then that's where we will shine, and we will continue to shine. So learning and knowing and standing in our truth of public health practitioners is another thing that would help us when we're dealing with young people, and learning about, first of all, meeting people where they are, meeting those young people where they are. And second of all, studying and learning as much as we can about the challenges that they face. Third of all, and this is not, there's a much more to that as well, understanding our own challenges that we had to face when we were coming up, when we were children. And as Ms. Quintunya was talking about, the role that I play in the self-help recovery of grown wounded children. When it comes to preventing child abuse, and I know I'm jumping a little bit, but when it comes to preventing child abuse, it starts with addressing the challenges that we as adults have and we need to deal with. By being healthy and whole ourselves as parents, that's the first way that we can prevent child abuse.
Oh, look at that. Look at our president. She's cheering because it is great, right? It is so nice. And again, all of the stories that you have shared with us, it is not you being rambunctious or obnoxious and marching down the street, right? It is you just, again, like you just said, walking in your truth, speaking in your truth, doing it, right?
Oh yeah.
Doing your thing.
Mm-hmm. Doing your thing.
And that is what's the most inspiring part that I'm receiving, as well as others. There's a lot of people, they're rooting for you. They got amazing quotes from you, loving persistence. This is the best story on the planet. They want you to join the UGA's mentorship program because this is great. This is great. And the inspiration that you have poured in those children way back when, there are still children that need that. Mm-hmm. There are still so many children that don't have the access, that don't have finances, don't have the support. And that definitely rolls me into my next question is, how are mental health issues, and it can just be any public health issue really, but really mental health amongst children addressed in the Navy? And how do you think the management of those issues could be effectively addressed for military families?
Well, we have counseling services that are available and resources for our military children. I'll just say it in general, military children. What has to make sure is in place is the fact that military children face things that the average child does not face. You have a parent, for example, who you may see them literally, you may see them today and not tomorrow, because if they're going in a combat zone, or if they're going in, have to do a geographical bachelor role, they may never see their parent for 6 months to a year. And that's traumatic for some children, or for any child for that matter, to have an absence in their lives. Then also, in addition to being a child growing up with parents who have to support and defend the Constitution of the United States, that weight on their shoulders, not only fighting to protect the freedoms of Americans, but to protect the freedoms of their own families. That stress and that weight is enough to cause a child to say, well, mama, daddy, I need you too. More so than you realize when you're wearing that uniform, you're still mama and daddy to me. So understanding that our children of veterans have to face different things. And then you add on to the societal ills of racism, socioeconomic problems, drug abuse and drug issues, just the strain in society that still is there. And then you pile on being a military child. It's critical that difference be understood and be embraced delicately as it's treated.
Very delicate. And for those of you who are not involved with the military, well, not today, but this month, the month of April is Month of the Military Child. And that's also very dear to my heart because I am a military brat.
That's right.
My dad served, I think, like 22, 23 years. My mother-in-law is a veteran. My husband is serving active duty. Our president, Erica Parks, is a veteran. So it is very delicate. And a lot of times it's misunderstood. And I have 2 kids of my own, and I'm seeing it from a parent perspective that it is tough. It is tough when you see your child walk up to all these random uniforms. Daddy, no, that's not your daddy. That's not your daddy. You know, they just see that camouflage. But what I can tell you is it's people like you, Lolita, that are pouring out your heart, and you're listening and you're acknowledging and you're asking children, what do you think? You know, what are you feeling? I want to know, what is your heart? Because as my mom has always told me, little kids or kids in general, they are people, and we forget they're people. And we tend to forget that they sometimes have an opinion. It's not always wanted, right? There's a time for everything.
It may not always come out right.
It might not come out how you want it to come out. And I'm sure you know that as a 12th grade teacher.
Oh yeah.
But it's still the point that you're making of acknowledging children and the stressors that come with military. There's a lot that goes into that. And thankfully, we do have resources for military families and for children. Children have their own specific resources. They have military life counselors in the daycares and in the schools talking to the children, with permission of the parents, of course, but they're out in the schools. And if you have any problems with your children, they're there. And we have that support. And so I thank you for being that person and recognizing that, and just being that one that's out there that is going to ask children, what do you feel in this moment?
Oh, yeah.
Very important, very important. And so as we start to get to the end of this, I wish we had more time, but we're coming up on the end. And
I can talk fast now. I'll fill it in.
You mentioned already a little bit about being a 12th grade teacher and how you contribute to your students. But what is your why as a 12th grade environmental science teacher? And what do you really hope that when your students graduate, what are they going to take away from your classroom?
I want them to always understand that each of them is responsible for making this world a better place to live. And that begins by asking themselves the question every day, who am I? If they're able to look in the mirror, ask themselves that question every day, it will set them on a trajectory toward seeking truth, toward excellence, toward compassion for others, because they're able to look into their own eyes, their own hearts, their own mind, and say, what is it today that I can do to make this world better? What is it today that I can do to lift a heart, to lift a bowed down head, to make a way for someone, to open a door, at least help hold it open? What can I do today? And I always want them to remember to embrace their sense of wonder, be aware of what's around. Even though there's a lot of hellish things that are going on, we can always look and find some love and some beauty somewhere, and let that be what carries us through the day. Let that be what carries us through the day.
More quotes. I hope you're writing them all down, Kim.
And keep moving forward and upward. Forward and upward.
I'm telling you, our whole postcard is just going to be Lolita.
It's going to be Lolita. Make sure you give her credit, though. We want to make sure we give her credit.
Absolutely. This has been fantastic.
She's copyrighted. We can't. The college can't get okay.
Bam.
So with everything that you have talked about today, this might be a hard one, and it might not. You might know, but what accomplishment are you most proud of?
Oh, the one I'm most proud of is bringing honor to my parents' name. Being a Christian, we're taught in the Bible to honor our father and our mother, that our days may be long upon the face of the land. And when I'm teaching Bible study, I often give a different, I'll say a more in-depth explanation of that. And it's regardless of what someone's faith background is, and not to become offend anybody in any way. But I picked that scripture apart and rightly divide it. And I say, when it says honor thy father and thy mother, it is to bring honor to their name. And here's where the counseling part comes in. Doesn't matter where they came from. Doesn't matter whether they hurt you. Doesn't matter whether they were rich or poor. Doesn't matter whether you come from a loving home or a home that was low nurturance and you felt unwanted or unloved. If you can live your life in such a way that it brings honor to their name, when they walk into a room of people they don't know, but who know you, and they are treated with the utmost respect, they'll say, well, how do you know my child? And they'll say, oh, well, we know so-and-so, or I'll just use my name. I remember my mother, she walked I grew up in Detroit, Michigan, in the inner city. And around the corner stores, they had children that they often refer to as thugs. But these thugs went to school with me. And so they knew that I always said please and thank you. I treated them well. I didn't care whether their pants were sagging or whatever they were toting or whatever. And I was always greeted them with a smile. And whenever my mother would walk into that corner store, they would always say, good morning, ma'am. How are you today? And they said, well, are you Lolita's mother? And she said, yeah, how do you know me? I said, we know her. And we want to respect you because we know her. So hence bringing honor to my parents' name. Wherever they go, whatever they do, I want to make sure that I live my life in such a way where their backs can stand straighter regardless of where they've come from or what they did or did not do. And for all people, whatever your parents did or did not do, it does not matter if you hold or harbor any type of ill will. Just do the best thing that you can do. Be the best you that you can be and bring honor to their name. Oh man, what a gift.
Oh my goodness. You sure your last name not Chapman somewhere up in there? Sounds like I'm talking to my mom or my grandma. And I love it. It is such good advice. I mean, I'm not even going to ask the last question. What advice do you have for graduating collegiate seniors? Because this whole entire talk will benefit the next public health professional in the real world, regardless of what sector they're interested in or they think they're interested in or whatever their pathway looks like. We just need to make sure we post this recording so everyone can have access to it. Because even Dr. Feldman, there must be a way for an entire UGA public health community to learn from Lolita. It is, we're going to make it possible. So I just hope you prepare yourself, okay?
Right.
You get prepared to be on the University of Georgia's platform sooner than later.
I would be honored. I would be honored. And I don't know whether Mr. Feldman is coming in, but I know that when it comes to veterans in particular, I wanted to kind of go back, because I'm thinking about that. What the students could do is just remember to say thank you. Include veterans in decision-making plans for their perspective, and understand that some of us have wounds that you will never see. All right, I'll be quiet so that you come on in. I'll be quiet. I know when to shut up.
Well said. Well, before we get started, hearing from Dr. Feldman as well as Eric, I'm going to go ahead and close this out by saying thank you.
Oh,
thank you so much for answering the call. We never know, what our alumni are doing, what they are up to until we get that response. And so I appreciate you for taking the time to respond, as it is much appreciated. I'm sure all of my board members are very thankful that you have contributed to such a great initiative that, again, it's 1 year old. All righty. So thank you for the time and the opportunity. I've learned so much. I'm sure everyone else has learned so much. And also, Lolita, feel free to stay engaged. Keep checking those emails, keep reaching out. We are here to support you and the rest of our alumni. We love all of you guys. We are alumni ourselves. So we feel that and we love that. And we appreciate you so, so much.
Thank you.
So for you and everyone else, stay tuned for next month as well. We have this happens every month, the last Tuesday of every month. There is emails that go out. You'll see board members and the college sharing it everywhere on how to register for next month. So on May 31st, our next Black Alumni Connection series is going to be centered around Mental Health Awareness Month. All right, it is acknowledged by everyone across the universe, really, especially how big mental health has been over the past, as we know, 2 or 3 years dealing with the pandemic and trying to continue on with our lives. We are going to be intersecting between exercise and mental health, because we're also not only acknowledging Mental Health Awareness Month, but it's going to be National Physical Fitness and Sports Month. And we're going to have Dr. Amber Berry and Dr. Ebony Caldwell on board, and they're going to be talking and sharing their expertise and experience as well as Lolita has done today for us, giving us that insight to what you are doing. All righty, so that's it on my end. Again, thank you so much, Lolita. We are going to now hear from our president, Erica Parks.
Thank you.
I thought you was about to close us out. I was like, no. I want to personally say thank you again, Lolita. I know you probably have been away physically from the college for a few years, but if you really look at our rebranding and our mission today, pursue, understanding, and take action, you're it. You have not been disconnected. You are well in tune today in real time what the college is doing. And so everything that you're doing, I'm excited about it. I always like to recap some notes that I take so that people really get them. Taking time to educate others and creating teachable moments. That's what I got from you. So I'm gonna go through 4. The second one, Ready to insert support. I love how you highlight those relationships, cultivating them, because there will come a time where you need to insert them to help. And we're going to be calling on you to help us insert some intentional people to continue to move the college forward. And the third one, intertwining your experiences and knowledge to shape the world. And you didn't say this, but from your talk is what I got. You have found a way to reimagine public health. You have found a way to teach everyone, everywhere you go, what public health is and how we can do amazing things, just letting us be in that space and letting us lead from the front. Because a lot of times that is exactly what we do. We're leading from the front. Yeah. And the last one, overcoming barriers by creating change. It's an excellent example of what the college is doing, what UGA is doing, honoring the year of desegregation, having this Black Alumni Connection series to highlight public health change makers of colors like yourself. So I want to just wrap those notes up. I don't have to go over the CPH news that Quintunya gave. I do want to give a correction to the date. The date is May 24th, but everything else she said is right. We switched the date. That's why you didn't know. And I want to bring a highlight to something that you all don't know about the College of Public Health. College, universities, a lot of people think, oh yeah, they all do the same thing. They have these different focuses, but we're different, right? We're different. We're UGA and we're the College of Public Health. Something I stumbled across in looking at environmental health and how we can intertwine environmental health folks, and we have an environmental health alum. UGA recently, UGA, the College of Public Health, just got an NIH grant in partnership with Morehouse School of Medicine, supporting environmental health training for underrepresented communities. This is amazing. They called this advanced program FRESH for short, which is Frontiers in Environmental Science and Education. And so this program is going to start this June, and they're taking 20 of our dynamic faculty to help support this program. So I thought you all might want to know about that.
Beautiful.
I just got a text about a date change. Scratch 24. The date was changed back to the 31st for the speakers. So next month on the 31st, make sure you come back. And the last thing I want to tell you about, and you'll receive the link when you get our follow-up email, we have a wonderful impact report that was printed out to showcase what we do here at the College of Public Health. We don't only educate students, but we do some amazing things to help students succeed. When it comes to donor donations, since the inception of this board, donations from public health alumni have increased in FY21 to $15,290. We have 2 times alumni donors since our inception, and 40% of FY21 donors were public health alumni. So we are really re-engaging our alumni. In here, you'll also read in the link about our 5 health equity fellows and where they are in this country doing some amazing public health work. We also have a food pantry in here where you'll see where we're providing food for students. We know we live in a country that we still have food insecurities, and this is very important. I also want to highlight the Stuart and Renee Feldman Health Disparities Awareness Fund. And Dr. Feldman is the major donor, he and his wife behind this. So you're going to hear about that and all that is doing to support opportunities to develop a greater understanding of health disparities and to participate in activities designed to address the problems of health disparity. So when you get that link tomorrow, look in here. And we also just started a 2005 society. The minimum given amount is $20.05. The significance of the 2005. You can do that one time, you can do that monthly, or you can do $205. So I'm challenging you tonight. If you're really excited about what we're producing here at UGA at the College of Public Health, to donate that $20.05, click the link. Do we have the link available? Lindsay, are you able to share the link? If not, I'm going to ask you to go to UGA College of Public Health and click giving and give tonight so we can continue to support our students, that are going to be some amazing alums in the public health field. Thank you so much for joining us and hope you have a great and safe evening. Goodbye.